My dear viewers, good evening. Today I like to discuss one of the most important topics in medical science. This is called rheumatic fever. Very much important and very much tough topic. Sometimes it is overdiagnosis, sometimes it is underdiagnosis due to laboratory mistakes. First of all, I like to give the definition of the rheumatic fever. Rheumatic fever may be defined as it is immune-mediated multi-system non-supportive inflammation of the joints, heart, then central nervous system, skin, and subcutaneous tissue, triggering by group A astrological beta hemolytic as upper respiratory infection. Remember this. Pathogenesis is very much important in this disease. Pathogenesis, what the most important culprit organism is concerned with this rheumatic fevers. The primary organism is group A astrological beta hemolytic as M protein 1, 3, 5, 6, 18 and 24 is a culprit organism concerned with the rheumatic fever. Remember this. Now, first of all, what are the pathogenesis? You must know the pathogenesis. After group A astrological beta hemolytic as upper respiratory infection of throat or sore throat, then what will happen? There is release of antigen. This antigen is stimulate the immune system of the body, then produce antibody, which cross reacts with the tissue glycoprotein of the heart muscle and synovial membrane of the joints, the central nervous system, then skin and mucous membrane. This is the pathogenesis. This is called cross-reacting antibodies, and it is type 2 hypersensitive reaction. Remember this. Now, how the patient is present to you? The patient is present by fever and arthritis. And arthritis always it is a large joint is involved, like knee joint, ankle joint, elbow joint, wrist joints, and it is migratory in nature. Then in the carditis, that is pericarditis, myocarditis, endocarditis. In pericarditis, there is pericardial pain, pericardial effusion, and pericardial rub. And myocarditis, there is a cardiac, that is a conduction defect and cardiomegaly. Conduction defects means in ECG there is a PR interval will be prolonged. This is the conduction defect. Then endocarditis. Endocarditis means there is a all valve is involved, especially mitral one, mitral regurgitation, aortic regurgitation, mitral stenosis, and aortic stenosis is the pathogenesis of this disease. Very much. This is a heart pathogenesis. Next, central nervous system. Central nervous system is involved in substantia nigra and globus pallidum and caudate nucleus, which causes there is a pseudonym chorea. Then pseudonym chorea means there is a involuntary, purposeless, non-repetitive movements of the face, trunk, and limbs. This is called chorea. Now the chorea, what are the clinical manifestations of the chorea? The first early sign of the chorea is dropsting, handwriting will be deteriorated, and there is a phonetor sign is positive, and also when the outstretched hand, what is outstretched hand like this? Then that is a wrist will be flexed and hyperextension of the all the metacarpophalangeal joint. This is called dinner for deformity of the wrist joint. Then if there is a darting tongue and frequent movements on the face, seems to be looks like society smile. And there is also these are all the deep jerk are exaggerated. You should remember this one. Next is erythema marginatum. Erythema marginatum is map-like structure, map-like rash in the all over the skin. This is called erythema marginatum. Then subcutaneous nodules is a form, small nodule over the bony prominence over the knuckle and the olecranon process and the medial malleolus and all the joints like elbow joint, wrist joints, knee joints, and ankle joints. These are the subcutaneous nodules. Now, what are the investigation? Investigation should be done. Complete blood count. With complete blood count with C-reactive protein, and complete blood count there is a polymorphonuclear leukocytosis and ESR will be rising, and acute phase reaction ESR C-reactive protein will be rising, and ECG there will be fear interval will be prolonged, and thoughts of culture therefore will be positive, and so titer will be rising, and other astrological antibody will be rising. Remember this. And next we go to for one extra test for the see the cardiomegaly, and on echocardiogram should be done to see the valvular lesion. This is the investigation. Now the treatment. First treatment is they give the rest, complete bed rest until unless sun syndrome disease appears. Next, you go for the antibody treatment on the upper respiratory tract by the phenylmethyl penicillin given 250 mg 6 hourly for 10 days, or one single dose of benzathine penicillin should be given. 6 lakh should be given intramuscular. Those individual weight is less than 60 pound, and 12 lakh units given single dose intramuscular. Those individual weight is more than 60 pound. Remember this. This is the pharyngeal treatment. Next is symptomatic treatment. Symptomatic treatment means only carditis or arthritis. Then salicylate 100 mg per kg worth of the body given divided dose for 2 weeks. Then tapering the dose salicylate 75 mg per kg per day for another 2 to 4 weeks. Next, carditis with cardiomegaly. If carditis is cardiomegaly, then we given the prednisolone. Prednisolone should be given 2.5 mg per kg per day for divided doses for 2 weeks, and tapering for another 2 weeks. During tapering, we given the salicylate for 75 mg per kg per dose should be given another 4 to 6 weeks. Now then the treatment of the chorea. Mild chorea. In mild chorea, you give the diazepam, and severe chorea, you give the haloperidol 0.02 to 0.05 mg per kg, so that should be given for the chorea treatment of the chorea. And erythema marginatum and subcutaneous nodule, no need to give any treatment. So this is the all. Now what is primary prophylaxis? Primary prophylaxis may be defined as the antibiotic treatment of the upper respiratory tract infection to prevention of the initial attack of the rheumatic fever. Now what is the secondary prophylaxis? Secondary prophylaxis means antibiotic treatment of the upper respiratory infection or group S protocol beta hemolytic gas of the individual who had already been suffering from rheumatic fever. This is called secondary prophylaxis. Secondary prophylaxis should be given at least for 5 years from the last attack, or 30th or 21st birthday, whichever will be the longer. Next, if rheumatic fever with a rheumatic heart disease, the secondary prophylaxis should be given for lifelong. Remember this. Now, what are the other causes of chorea? This chorea, the other cause is genetic cause of Huntington chorea. Huntington chorea, this is genetic cause, and Wilson disease, this is also genetic cause. Then some drugs causes chorea, phenytoin, phenobarbital, and oral contraceptive can causes the chorea. Another one is hypothyroidism. Hyperthyroidism also causes the chorea. This is all about the rheumatic fever. Thank you very much for patient hearing. Thank you very much for patient hearing.